Welcome to Mike and Stephane's podcast. Today, we will be covering an interesting injury of the lower back. Spondylolisthesis is a condition that is a result of numerous issues such as a birth defect, fractures, degeneration due to age or overuse, tumors, surgery, or spondylolisthesis. Spondylolisthesis is usually a complication of spondylolisthesis, which is a degenerative arthritis, osteoarthritis of the spinal vertebra and related tissue. If severe, it may cause pressure on nerve roots with subsequent pain or paresthesia in the limbs. Spondylolisthesis is an anterior or posterior slipping or displacement of one vertebra or another, usually L5 to S1. Most often, that happens in the low back, lumbar spine, because that part of your spine bears a lot of weight and absorbs a lot of directional pressures. In other words, your lumbar spine has to move quite a bit, rotate in various directions, while carrying your body weight. Sometimes, this combination can put so much stress on the vertebrae that one of them slips forward. Spondylolisthesis can occur in a number of ways that affects the movement and action of the pars interarticularis. One of the mechanisms in which spondylolisthesis can occur is the repeated hyperextension of the lumbar spine or a sudden violent hyperextension of the lumbar spine. Another mechanism can be due to an imbalance in muscular strength, muscular endurance, and flexibility of the trunk. Most individuals have a general complaint of a persistent sore low back pain. Pain is usually felt after standing, sitting, or staying in a particular position for long periods of time. The individual may experience radiating pain starting from the lumbar spine to the buttocks, then down to the knees. There may also be complaints of a dull, aching pain accompanied by cramping pains at the low back. An increase in pain may occur with standing, trunk extensions, and trunk rotation. Pain may decrease with subtle adjustments to the posture. Upon inspecting the lower back region, one obvious contributor to low back pain or injury is lumbar lordosis. Individuals with extreme curvatures of the lumbar spine are more susceptible to low back injuries. Spondylolisthesis can also change the walking gait of an individual affected by it. It can cause a decrease in stride length and/or cause the leg to stiffen up. The individual does this to compensate for the pain being felt at the lower back region. Another visible trait of spondylolisthesis is the waddle walk, sway back, and/or protruding abdomen. All this can lead to muscle imbalance, which is added pressure pulling on the bony structures of the spine. This extra pressure can cause the pars interarticularis to weaken at the spine and eventually crack. Now, the clinician will start to palpate the area of pain, including both muscular and structural. The clinician should also palpate nearby structures and muscles of the area, making sure to cover the depth and distance of pain. Palpation should reveal a step-off deformity or vertebral slippage of a spinous process, usually from L4 to S1. There should be some point tenderness over the involved discs of the lumbar and sacral spine. The individual should also present tightness over the paraspinal and hamstring muscles. There are certain cases where nerve roots are impinged by the tight muscles of the spine and the piriformis located deep to the gluteals. If the piriformis is tight, the individual may report radiating pain because the muscle is impinging the nerve. Active range of motion of the trunk should produce sharp pain with extension, lumbar rotation, and lateral flexion at the site of injury. Trunk flexion may be limited. This is also the case with resisted range of motion of the trunk, which also reveals weakness of the erector spinae muscle group during resisted extension. Active range of motion of the hip should produce sharp pain with flexion and extension at the site of injury. This is also the case with resisted range of motion of the hip. Passive range of motion of the hip should produce stretch pain with flexion due to hamstring tightness. Some cases have reported radiating pain with passive flexion of the hip due to piriformis tightness. When performing the spring test, the examiner carefully pushes the spinous process anteriorly, feeling for the springing of the vertebrae. The spring test is used to determine hypomobility of a vertebral segment caused by facet joint dysfunction. Hypomobility or hypermobility of these joints can potentially cause pain along the spinal column. The patient lifts one leg, then places the trunk in hyperextension. The examiner may assist the patient during this motion. The procedure is then repeated for the opposite leg. Shear forces are placed on the pars interarticularis by the iliopsoas, pulling the vertebra anteriorly, resulting in pain. The patient extends the spine as far as possible, then side bends and rotates to the affected side. The examiner provides overpressure through the shoulders, supporting the patient as needed. Particular pain indicates compression of the intervertebral foramina that impinges on the lumbar nerve roots. While keeping the knee in extension, the examiner raises the leg by flexing the hip until discomfort is experienced or full range of motion is obtained. The patient complains of pain before the end of the normal range of motion, 70 degrees. The pain may be described as radiating distally along the tested leg, usually in the posterior thigh, radiating into the calf and perhaps the foot. Initial treatment for spondylolisthesis is primarily based on the patient's symptoms. Daily activities should be modified with hyperextension of the lumbar spine avoided. Future considerations should involve strengthening and flexibility exercises for the core.